In this video, I will be talking about the period of time from the day of my hardware removal surgery up until the day before my stitches came out. I had a midfoot fusion on July 30th, 2024 for a Lisfranc injury, and I had 4 screws and 2 plates to fuse the first and second metatarsals of my right foot. The hardware gave me a lot of irritation while driving, and I was often aware of its presence, so my surgeon and I decided to have the hardware removed on the morning of Friday, May 1st, 2026. If you want to know more about how I came to the decision of having the hardware removed, check out the links in my video description. On the day of the surgery, I could continue drinking clear liquids until about 3 hours before my surgery, which was great because I was able to hydrate before arriving at the hospital. I showered before we left the house so I could wash my hair, and also I had a feeling that I might not be up to showering that night after the surgery. My husband and I got to the hospital a little early, so we took a short walk around the parking lot since I knew that it was going to be quite a while before I would feel up to taking walks again after the surgery. I unfortunately could not keep my hardware due to hospital policy, which was disappointing because I've heard of other people getting to keep theirs, but my surgeon did show me a picture of the hardware after he'd taken it out, although I did not get to have a copy of the picture. I've seen pictures of titanium orthopedic hardware that is pink, purple, and teal, but mine ended up being silver. Since I have a bleeding disorder, I had to get DDA VP 30 minutes before getting the nerve block. The nerve block was pretty simple. It was 2 or 3 shots in various points of my leg, and it helped with pain for several days after the surgery. I was able to go about 3 or 3.5 days without needing to take painkillers at regular intervals before it fully wore off. The hospital had a note in their system that I have a tendency to wake up quickly after surgery, and as is tradition, I woke up within 15 minutes of my surgery wrapping up and was asking for water almost immediately. Matt and I were allowed to leave the hospital pretty quickly after the surgery. I think we were out about an hour or so after the surgery was over. I noticed I felt pretty alert on the ride home from the hospital, which was a surprise, but I lost energy pretty rapidly after getting home, probably within about 10 or 15 minutes after getting into the house. My parents met Matt and me at our house to give us some food that my mom had made, which was really nice so that we didn't have to worry about an immediate meal, and they also helped get me back into the house since I was non-weight bearing after the surgery for a few days until the nerve block wore off. After they left, I took a nap because I was starting to crash pretty hard. I didn't shower that night because I was too disoriented and exhausted, but that day in general was definitely easier than the day of the midfoot fusion surgery. Most of my Saturday was spent taking naps and recovering from the anesthesia. My brain stopped feeling so fuzzy by the end of the day, and I stopped feeling nauseous by dinner time. I could move my toes a bit already the day after the surgery, but I made sure not to go out of my way to move them too much, and I could move my foot up and down, although not fully. I started getting a pins and needles feeling in my foot towards the end of the day, like it was starting to wake up a little bit, but it didn't hurt. I also noticed that the bruising and swelling after the surgery wasn't nearly as bad as I expected it to be. I was able to manage the swelling pretty easily with elevation and regular icing. Something I noticed over the next few days as the nerve block slowly wore off was that even though I could feel very little below my knee, I had a very good sense of when my foot and ankle were swelling too much and needed to be iced. Also, unlike after the midfoot fusion, I had a much better sense of where my foot and leg were, so I didn't feel like I was in much of a danger to myself when trying to move around the house. The nerve block did start slowly wearing off on the end of the first day, but I still had very little pain. It wasn't until between Sunday night and Monday morning, so the 3rd full day after my surgery, that I noticed a large spike in pain from the nerve block wearing off, so I got some pretty good mileage from the nerve block. The area around the incision did begin hurting before the nerve block wore off, but it wasn't anything that was unmanageable over the weekend. I did need to start taking painkillers at regular intervals when the nerve block completely wore off. Even though the recovery from the surgery wasn't as painful as the midfoot fusion, the pain was definitely still pretty strong from pulling out the plates and screws. I did use crutches with a walking boot when I first started walking again. I learned pretty quickly what my limit for movement was during the period of time that I had the stitches in because my foot would get puffy and much more painful if I stayed up for even just half a minute too long. If I tried to do too much in a day, my foot would hurt too much at the end of the day to be able to sleep well, especially during the first week. I had to be very mindful of the fact that even though this was not as big a surgery as the midfoot fusion, that I did still have to take my time with recovering and taking it easy. I had to keep reminding myself that I was going to need to give myself the time that my foot needed for the holes in my bones to fill in where the screws used to be, and also to allow for all of the other healing that needed to take place. Taking it easy is something that I have struggled with in the past when recovering from injuries and surgery, and my 2 foot surgeries have really been teaching me the meaning of patience. The 4th full day after my surgery was probably one of my worst days. My foot was on and off super painful throughout the entire day, and my ankle was just so sore. Even with the painkillers, the pain and irritation in the first 2 metatarsals were still pretty bad where the screws and plates had been taken out. I was still able to move around using my knee scooter and crutches, but that day was still pretty difficult. I was able to rewrap my ACE bandage with permission from the surgeon's office that evening because that and the bandaging underneath it had started to get looser since the surgery. And then later in the evening, the pain in my foot began to be less excruciating. After that day, the pain I felt in my foot seemed to settle down to being more tolerable and manageable. On the 5th day, I still needed to take pain pills regularly. However, on day 6, I stopped needing to take the prescribed pain pills throughout the day, so I thankfully only ended up needing to take prescription painkillers at regular intervals for 3 full days after the surgery. Although the painkillers were definitely very needed since the pain from the nerve block wearing off was worse than what I had expected for a few days, I felt so relieved to have the fogginess in my brain wearing off since I was able to stop taking the painkillers during the daytime. To celebrate my foot starting to feel so much better, Matt drove us to Taco Bell down the street, and I had my first car ride since my foot surgery on day 6 after my surgery. I had to sit in the back of the car so I could have my foot elevated, but it was a fun little car trip, and Baja Blast Zero was available, so it was a truly excellent day. Since I knew what to expect from foot surgery from already having had a midfoot fusion a couple years ago, I had an easier time understanding what my limitations were, especially when I was first recovering, and I also had an easier time asking for help after this surgery. I did still have a hard time staying still during the first several weeks after the surgery. I had also forgotten how time-consuming it was to keep putting on the walking boot every time I needed to get up to walk, and how sweaty my leg would get in the walking boot since both of my surgeries took place during the time of year when it was getting warmer. I know that may sound very minor, but spring was really warming up, and sometimes I just didn't want to have to deal with the walking boot. Thankfully, after the surgery, I only needed the boot for about a month or so. Matt, my family, and my best friend Bethany did a great job of helping me through the roughest time of the surgery and making sure that I didn't overextend myself, and at times I really did keep them all very busy, but I did learn from the first surgery to stop and think about whether it was smart of me to get up and do something on my own, or if it was better to ask for help and give my foot an incision the time it needed to heal. It was not easy to have patience during the healing process though, because I'm used to being on the more active side and I love being able to go outside for walks. The second week after my surgery was when I started to struggle the most with getting less exercise than I usually do, but my family and Bethany and Matt all did a really good job of helping me through it and keeping me as busy as they could in ways that did not involve being on my foot too much, since I still needed to keep my leg and foot elevated as much as possible to keep the swelling down. Despite having the expected pain and aftercare needed for surgery recovery, I was shocked at how little swelling there was after the surgery and how much easier it was to get around and do things in public once I got through the first week after the surgery, as long as I was careful. I was able to get out to celebrate Mother's Day with my family and used a chair to keep my foot elevated while we were out for lunch. I was able to get back into going out for trivia night a week and a half after the surgery, although I was not able to drive. Matt was driving since it was my driving foot I had gotten surgery on, and I did need to have an extra chair to keep my foot up while being out. Our bartender was also kind enough to fill an ice pack for me so that I could ice my foot and ankle midway through trivia night, which was super helpful and that saved me from a lot of extra foot pain. I noticed that most of the swelling in my foot seemed to happen after being out for a while or from moving around for a while, but when I stayed still with my foot elevated, my foot and ankle didn't seem to swell too much, and the original bandaging from the surgery became much too loose and needed to be retightened each day, which I got permission from the surgeon's office to do. My mom redid the ACE bandage for me several times, which is something that she does very well, and my foot and ankle always felt better after she fixed up the bandaging for me. I was also very lucky that my job allowed me to do a combination of time off and working fully remote during the first few weeks after the surgery, since I had had surgery on my driving foot. I know that this is not something that everyone's jobs can accommodate for, and it was such a relief to have that flexibility. My appointment to have the stitches removed was on May 13th, so I had almost 2 full weeks with the stitches. Waiting to get the stitches out after surgery is always one of the hardest parts of surgery recovery for me because of how uncomfortable, itchy, and tight the stitches start to feel after a while. The incision for this surgery was in the same place as for my midfoot fusion, which was right on the top of the middle of my foot, running from near my ankle almost down to my toes. The stitches started to really feel as if they were pulling on either side of my foot and agitated in general on about day 6 after the surgery, and that feeling of general agitation around the stitches continued until they were taken out. It was especially uncomfortable when I had to have the walking boot on because anything that put additional pressure on the stitches made them feel worse. I noticed that additional pressure from the walking boot the most when I was walking and I would have to lift my foot up off the ground because then the top of the boot would come down and press on the stitches and incision as I lifted my foot up. I will have my next video coming out to talk about the recovery after the stitches came out. In the meantime, thank you so much for listening and I hope you are all doing great. Please feel free to leave a comment to let me know how you are all doing.